Good afternoon, everyone. I'm here today to give a report out on the work and some of the action items from our quarterly meetings that occurred Tuesday through Friday of this week. So I'll go through the various committees and what was done in each committee. So first was the Performance Outcomes Committee. The Performance Outcomes Committee has an overview report for the 2025 data notebook on wellness and recovery centers, and that is in its final stages of approval. It will be distributed to counties and stakeholders very soon. The report includes responses from 51 behavioral health boards and commissions and highlights the incredible value and importance of wellness and recovery centers in California. The committee aims to hold an online webinar presenting the results of the 2025 Data Notebook Overview Report early this year after the release of the full report. So stay tuned for that. The committee also partnered with CASRA, which is the California Association of Social Rehabilitation. So I messed that up. I'm so sorry. But they partnered with CASRA, who did a deep dive on wellness centers with over 30 wellness centers across the state, and they developed a report. And the council made recommendations that fed into that report. The committee is also focusing on behavioral health services for foster youth as a topic for the 2026 Data Notebook. The 2026 Data Notebook is in its early stages of development, and the committee had a panel presentation at their January meeting to help inform the committee on this topic. Additionally, the committee received updates from Anna Nafi on the activity of the Behavioral Health Transformation Quality and Equity Advisory Committee. The Performance Outcomes Committee has several members and partners who are also on this body, and they will continue to track the development of behavioral health measures. The next meeting is on January 26th for the QAEAC, and information for that will be on the stakeholder engagement page of the DHCS website. So moving on to the Executive Committee. The Executive Committee reviewed the Council's priorities for 2026 and shared that priority list during the Council's general session yesterday afternoon. The Executive Committee also discussed the status of work groups and how to make work meaningful in consideration of not having the staff or resources for the work groups. And so the way that the work groups will function is to have an advisory time-limited group with groups with specific projects and outcomes. It'll have limited membership and dissolve once the goals are met, and it's a means to engage with stakeholders. But this is still all kind of being worked out, but it was a discussion point during the Executive Committee. For the Patient Rights Committee, they're wanting to get connected to the mental health boards on what their awareness is on patient rights advocates in the community. There was a survey done a few years back, and so that's something they would like to connect with the boards on. They also discussed their work plan and integrating the focus on the whole council, so like increasing staff ratios for patient rights advocates, wanting to respond nimbly when there's new legislation and issues so that voices are heard, and prioritizing substance use disorder treatment rights. The Patient Rights Committee also presented to a general session this morning on SUD patient rights in inpatient facilities. The committee also received updates from Daniel Wagner on recent activities of the California Office of Patient Rights, COPR. The California Office of Patient Rights will be holding their annual Patient Rights Advocate Training Conference in Sacramento, and this will occur in mid-April, which is the same week as the Planning Council's quarterly meetings. So stop on by. In alignment with the new work plan priorities, the committee aims to connect with the behavioral health boards and commission members through CALBHB and to schedule a presentation and discussion during the April quarterly meeting. So we'll be in touch. Moving on to the Workforce and Employment Committee, the committee received a presentation from the Elevate program. Elevate is a $75 million investment over a course of 5 years. There's 5 total projects. 2 of the projects started in July of 2025, which is a behavioral health apprenticeship program. And then another program, I believe it's the loan.
Peer.
Oh, the peer. There was a peer support program. So that will be, those have launched. The remaining three, which is there's a there's a loan program, and then there is an apprentice nurse practitioner program, and then social work therapy and counseling internship program. These funds aim to address the shortage of behavioral health workforce and develop a strengthened the workforce, because we learned at our meeting that there's actually a need for 18 yeah, blew me away. 18,000 sorry, it's no laughing matter, but 18,500 behavioral health staff shortage in just San Diego County alone. And so that was really alarming to our members. And so this program plans to address 3,000 of that 18,500 gap in the workforce shortage through these 5 programs. So our committee is hoping to continue in talks with them, see how their implementation is going, and get a report out once these other programs have been implemented. Next is the also in the Workforce and Employment Committee, there was a presentation on the IPS, which is Individual Placement and Support Program, under the BH Connect Workforce Initiative, which is 2025 through 2029, as also a 5-year. BH Connect is a 1115 demonstration waiver, and there's $1.9 billion in the first round of funding for 5 programs, which is the Medi-Cal Behavioral Health Student Loan Repayment Program, Medi-Cal Behavioral Health Scholarship Program, Medi-Cal Behavioral Health Recruitment and Retention Program. There's a community-based provider training program and residency training program. And so DHCS, the Department of Healthcare Services, attended our meeting, and they provided us with how this IPS supported employment is functioning and intending to function in SUD programs. Moving on to the Legislation and Public Policy Committee, the committee voted to support 4 bills. The first is AB 1267, which seeks to require DHCS to offer a consolidated license and certification for adult alcohol or other drug recovery or treatment facility providers to operate more than one facility within the same geographic location. They also voted to support AB 1540, which intends to restore the Press 3 LGBTQ+ youth crisis hotline routing option available through the 988 Suicide and Crisis Lifeline. And this will require the California Office of Emergency Services to ensure technology allows for automatic routing. They also are supporting AB 1579, which seeks to authorize participating entities under the Children's Crisis Continuum pilot program who do not have a crisis residential program as part of its continuum of care, but has included a comparable type of treatment component designed to service children and youth experiencing the highest level of acute behavioral health needs in a residential program, and to utilize all awarded grant funds to fund any component of the continuum of care. We're also supporting SB 548, which intends to require a California Health and Human Services Agency to direct the Behavioral Health Task Force or successor group to create a set of recommendations to support implementation plans for reducing alcohol and drug-related addiction deaths by 50% on or before 5 years from the date the task force provides the recommendations to the agency. The committee is voting to oppose SB 367, which intends to authorize recommendations for an LPS conservatorship if a determination is made that the gravely disabled person has demonstrated an inability to accept voluntary treatment due to apparent incapacity, and would expand the list of individuals or entities that may recommend a conservatorship for a gravely disabled person without that person being an inpatient in a facility. It would also authorize the court, upon termination of a conservatorship, to refer the individual to assisted outpatient treatment or care court. The committee is also going to watch AB 3, AB 425, and AB 1105 in the meantime. I did want to take time to go through those legislative bills that the council and the committee specifically are planning to support and oppose. But I will be moving on now to the Housing and Homelessness Committee. The committee reviewed and approved their 2025 and 2026 committee charter and work plan, and they discussed two policy issues. The first issue was a discrepancy between the Behavioral Health Services Act and the federal housing and urban development regulations regarding the duration of transitional housing support. Under BHSA, counties can use BHSA housing intervention funds to provide up to 12 months of housing support in an interim setting or transitional housing. However, transitional housing programs funded under HUD's Continuum of Care allows up to 2 years of support. The second issue discussed relates to rent requirements in time-limited interim settings. Under BHSA, these settings must not require tenants to pay rent, which includes transitional housing. This creates a conflict for the continuum of care projects that must charge rent based on tenant income. The committee took a vote to escalate these two issues to the officer team for advocacy and potential letter to DHCS. Specifically, the committee is recommending revising the BHSA regulations to match the federal definition of transitional housing, which allows up to 2 years of support, and allowing programs to charge up to 30% of a tenant's income for rent. The committee, for the first time, also took a tour. So they went to Turn Behavioral Health Services, as they're committed to learning more about effective recovery housing models and exploring ways to advocate for programs that promote recovery and stability. Yes, so they took a tour, which is of Turn to Recovery, which is the local recovery housing program in San Diego. It's an outpatient program that serves individuals with alcohol use disorders and provides intensive case management, treatment, and recovery services, housing support, and recovery residences. And some notable outcomes from the program include the fact that there's 44% of participants, they exit to permanent housing, exceeding the goal of 26%. 24% exit to short-term placements, and only 0.5% return to homelessness. So seemingly effective program. Moving on to the Systems and Medicaid Committee update. The focus on the meeting was on BH Connect. And so the goals of BH Connect are to expand the suite of community-based services and evidence-based practices, transition people into community-based services as appropriate, support children and youth, and increase the behavioral health workforce. It's an 1115 waiver, as mentioned earlier, and counties can opt into some of the requirements while others are required. It includes things like federal financial participation for short-term stays at IMDs, community in-reach services, adult EVPs, so there's assertive community treatment, forensic assertive community treatment, coordinated specialty care for first episode psychosis, and there's some others as well. There's clubhouses, family therapy, children and youth initiatives, the workforce initiative that I had mentioned earlier. And so the committee also had San Diego County talk about the cost reimbursement to a bundled rate, which is a huge shift. And the committee had also asked San Diego County to come back in a few years to discuss how it went and discuss lessons learned and best practices. We also had Orange County talk about some of the challenges in regards to workforce and working closely with providers. Haven't really had complete guidance from what the provider's perspective is. So the counties and the providers are waiting on more guidance from the state. There's other factors like payment reform, getting IMDs from long-term to short-term stays, data gathering and analysis, and funding concerns. So all of those topics were discussed during this meeting. DHCS also was present, and they talked about some successful items from the 1115 waiver as it being a pilot project, that being moved into other authorities and potentially, having those as more than just a 5-year demonstration project. I will share that Sacramento, San Diego, and one other county, I think it was Santa Clara County, implemented the IMD, and there's various other counties that are in process of getting getting to implement the short-term stays and the IMDs. That concludes my update. Thank you for listening. If you have any questions, please let me know. I would also be happy to connect with you to send over any information that describes what I shared, websites, resources, things like that. Thank you.
Great. Yeah, usually I see an email that has all your reports in it following the meeting, so I can forward that to everybody.
Yeah.
Great.
Yeah. Okay, that sounds good. Anybody have any questions?
Oh yeah.
Any questions?
Anybody? No? Okay. All right. Okay, we have somebody. Harold, make sure you have a mic.
Okay.
That one's fine.
All right, that's fine. So that's a lot of funding for education for behavioral health positions. And, we have all over the state and the nation, kids getting student loans to go to college, which I think is a real shame, considering that college used to be quite affordable in this state and our money's been diverted elsewhere. So, we've got all these funds set up. What are the barriers, what's holding kids back from getting educations other than the cost of education? Is it the pay scale? Is it the cost of education? Is this program going to succeed in the end? That's really my question.
The presenters had shared with me that they are working with the schools. They are working with, they're planning to have community stakeholder engagement and work with various entities to ensure the success of this program. They want student perspectives as well, and we do plan to keep in touch with them for that. As a state entity, I can't really speak to what are the barriers to entry. I will say financially, it is one of the strongest barriers. As speaking as an MSW student myself, there are, from what I hear from my peers, there are a lot of financial barriers. Other than that, folks have other responsibilities and whatnot, but financially it is a barrier, especially for programs that have practicums, because the practicum requirements often make it very difficult for students to work full-time and pursue a degree while they're taking courses and having to do practicum. So they're internships to get clinical hours. Yeah, and so for the clinical hours, they're often unpaid, and so by paying for these internships and these practicum clinical hours, it reduces that barrier of getting folks being able to take care of themselves while they're attending school and taking care of their families.
So is the legislature, are they looking at doing something to alleviate those barriers? Because I will tell you, just quickly to take your time here, I've got a friend who's
I'm gonna stop you because
okay.
we have another speaker lined up.
That's
but
okay.
I can forward more information to you in terms of some of the workforce planning.
Okay, well, never mind.
I will just say briefly, the Department of Healthcare Access and Information is in the process of developing their 5-year WET plan, which is Workforce Education and Training Plan for 2026 to 2030. I highly encourage you to attend the Workforce and Employment Committee meeting in April, as well as the full council general session meeting in June, because HCI is statutorily required to work with the California Behavioral Health Planning Council to approve that plan. And that gives significant amount of funding. That's BHSA dollars that goes to workforce, as well as the state investing in this BH Connect Workforce Initiative.
Just one last quick question.
Mm-hmm.
The unpaid internships, is that a federal or is that a state requirement?
It's a licensing.
Okay, and the licensing.
Yeah,
I think you get what I'm getting to. You're very set up.
It's not a requirement. It's just a yeah. Mm-hmm.
You don't have a.
Oh yeah. So
I think you're too far into this topic.
Yeah. So I know the next speaker is lined up. I just wanted to thank all of you for your time, and thank thank you to those who familiar faces I see at our meetings as well, and your input. So I'll leave that there, and I'll hand it over to Teresa.